Next up on the agenda, we're going to talk about monitoring training load in collegiate soccer athletics. And I'm really excited to have Dr. Erin Pletcher on. Dr. Pletcher is an assistant professor at Thomas Jefferson University in the athletic training program. Erin, thank you so much for taking some time. And I want to really get into some of the key points from your presentation, talking about load and how load influences training and recovery. Can you kind of break down internal versus external load and how those factors influence training, recovery, and fatigue?
Sure. So thank you, Ryan, for having me, and thank you for covering our ATSNJ conference. Part of my speak was because I was grateful enough to receive grant funding from them to do some of the soccer research. And so to answer your question, we can look at load in two different capacities, which you mentioned. External load, so that's the work that's prescribed to an athlete. And so that prescription could be in our team training sessions, that could be in our strength and conditioning out of season sessions. We can measure that by the number of minutes that we're training. We can measure that by the miles that we're running, the number of accelerations and decelerations specific to soccer. A lot of the soccer literature measures external load by those accelerations, decelerations. They split running distance into high speed, which is 5 meters per second or 5.5 meters per second, and sprint speed, which is 7 meters per second. We can also look at internal load, which is how the athlete individually responds to those external loads. And so if the whole soccer team is running 2 miles, that's our external load. Our internal load could be measured by perception of effort, so readings of perceived exertion on a scale of 1 to 10. This 2-mile run was a 10. I think I'm going to throw up and die. Or we can measure it by heart rate. We can measure it by lactate. You know, what are those physiological changes occurring in the body?
And when you're monitoring those, you talked specifically about the importance of monitoring fatigue. And I love how you described the different stages of fatigue, and specifically you talked about this thing called functional overreaching stage. Can you kind of talk about those stages of fatigue and then why we as athletic trainers, we want to help our supporting cast keep those athletes from going beyond that functional overreaching stage?
Yeah, so great question. So every time we exercise, we have some sort of state of fatigue. That's how we get stronger, that's how we get faster. When we allow enough recovery time, we call that supercompensation. And so if you're looking at, we're starting at a baseline, we do this load, the athlete gets tired, but if we allow that recovery, then they start to get better at strength, speed, again, whatever your intentional target training is for. And so if we don't allow that recovery time and we continue to overload our athletes, then we get to this functional overreaching. And that just means we need a little bit more time of recovery for them to get those positive benefits. So it's short-term fatigue, short-term performance decrements. We move from functional overreaching to non-functional overreaching, where we're just tiring our athletes out. We're running them, and we're not ever going to get any positive benefit from this. And so as sports medicine clinicians, our whole job is injury prevention and then injury rehab. And so we prefer the injury prevention part. That non-functional overreaching is going to lead eventually to the injury rehabilitation part. So we get past any sort of positive benefits from those training sessions where their body is breaking down and unable to build itself back up. If we continue training and give them no rest at all, we'll get into overtraining syndrome, where we see a lot of overuse injuries, a lot of chronic fatigue that's months of recovery before they're going to get back to even their baseline capacity.
And it's great to think about that spectrum. It puts it in a better perspective in terms of monitoring and the importance of monitoring, because I can imagine it's kind of a very fine line between one stage and the next. So as athletic trainers, what are some suggested strategies that you have to help facilitate monitoring fatigue, whether it's you yourself as an AT or working with your strength coach or your sport coaches? What do you suggest focusing on?
Sure. So that's a great question. That was part of the study I did. A lot of the literature is with elite athletes, so they have maybe a different baseline fitness than the athletes that I was working with. And they use heart rate and GPS, which those systems are tens of thousands of dollars per season for every season. And so we were looking at other ways that we can measure fatigue. And so traditionally we look at heart rate. And so if there's an increase in resting heart rate, you know that that individual's body has to work harder to keep up. When they're exercising, doing the same training session they did last week, their exercise heart rate is higher. Again, their heart has to work harder to keep up with those body demands. So heart rate is one measure. If you have the ability, with smart technology now, you know, a lot of people have Fitbits, Apple Watches. We can incorporate that if we're able to. I use the Just Jump mat as a measure of explosiveness or more neuromuscular performance. And so in the literature, that has been shown to be sensitive to fatigue throughout the course of training seasons. And so to look for a decrement in jump height. I think even just talking and educating the athletes, getting them to understand, so we can do sessions of readings of perceived effort. And so getting them to listen to their body and know when they are feeling fatigued, explain to them what the signs and symptoms are, but also talking with the coaching staff who is giving them that prescribed external load, that sometimes your athletes are tired and they're not, you know, trying to get out of a practice or get out of a training session. Like that's just the way that individual athlete's body needs extra recovery time to respond in a positive manner.
And that all wraps up into the importance of teamwork and collaboration between you as the athletic trainer can't just do that all yourself.
No.
So that's so crucial to have those conversations with your colleagues and your teammates there to make sure that you're, you know, across the board, keeping an eye on those risk factors, helping to monitor, looking for those red flags that you talked about. That's so crucial because you're not going to see it all as the AT.
Yeah, absolutely. So, you know, a large part, I feel that our job is educating the student athlete, educating their parents, if that's the environment you're in, educating the athletic director, the coaching staff, the strength and conditioning coaches, because our goal is for them to win games. We don't want to hold them out. Everybody gets grumpy when that happens. And so, you know, trying to prevent that from happening to begin with. And if they need, you know, an extra day of rest to be able to play the next 4 games that we have to travel for this week, then maybe give that a try and see if that helps.
Great tips, Erin. Thank you so much for taking some time. We all need to dive into that fatigue component much more depth because prevention of injury is the first thing we got to focus on. So thank you for taking some time and for sharing your insights and your research.
All right. Thank you, Ryan. I appreciate it.
You're welcome. Have a great day.
You too.